Fatigue and poor sleep. When should you worry? Most of us feel tired sometimes. But when fatigue and poor sleep do not go away, your body may be trying to tell you something. In this video, we will go through the important causes first, and the most common reason will be explained at the end. Reason 1. Sleep apnea, sleeping but never resting. If you sleep for 8 hours but wake up exhausted, the problem may be breathing interruptions during sleep, known as sleep apnea. The World Health Organization stated that over 1 billion adults worldwide are affected by obstructive sleep apnea, and many do not realize it. People with sleep apnea often snore loudly. This happens because the airway narrows and collapses during sleep. Each time breathing pauses, oxygen levels drop slightly. Over the night, this leads to repeated awakenings that you may not remember, but your brain never reaches deep, restorative sleep. That is why morning headaches and strong daytime sleepiness are common. In milder cases, reducing weight, avoiding alcohol before bedtime, and sleeping on the side can help. When symptoms persist, a sleep study is important, and treatments like CPAP can dramatically improve energy and sleep quality. Reason 2. Thyroid problems. When the body slows down, an underactive thyroid slows almost every system in the body, including energy use and sleep regulation. The National Institutes of Health stated that about 5% of adults have hypothyroidism, especially women over 50. When the thyroid is underactive, people often feel cold when others feel fine, gain weight without eating more, and develop constipation and dry skin. These changes reflect a slowed metabolism, which also explains the constant tiredness and unrefreshing sleep. A simple blood test can detect thyroid imbalance. Once treated with appropriate hormone replacement, many people notice steady improvement in energy and sleep over weeks to months. Reason 3. Anemia. Not enough oxygen delivery. Fatigue can also come from low hemoglobin or iron levels. The World Health Organization stated that nearly 30% of women worldwide are affected by anemia. When the blood carries less oxygen, the heart and lungs work harder to compensate. This is why people may feel breathless when climbing stairs, dizzy when standing up, or notice pale skin and cold hands. Sleep may be long, but the body still feels drained. Blood tests confirm the diagnosis. Treating anemia means correcting the cause, often iron deficiency, and once oxygen delivery improves, energy levels usually recover. Reason 4. Depression, anxiety, or long-term stress. Mental health conditions affect sleep just as much as physical illness. The World Health Organization stated that over 280 million people worldwide live with depression. Stress and depression alter sleep hormones. Many people wake up very early and cannot fall back asleep, or feel mentally exhausted even after a full night in bed. Loss of interest, low motivation, and poor concentration often come together with persistent fatigue. Addressing mental health through therapy, stress management, regular physical activity, and medication when needed can significantly improve both sleep quality and daytime energy. Reason 5. Chronic medical conditions. Fatigue is an early sign. Conditions like diabetes or heart disease often show up as fatigue before more obvious symptoms appear. The International Diabetes Federation stated that over half of adults with type 2 diabetes report ongoing tiredness. High blood sugar causes frequent urination and thirst, which disrupts sleep. Heart or lung problems reduce oxygen delivery during activity, leading to easy exhaustion. These symptoms should not be dismissed as just aging. Early screening and proper management can prevent complications and restore energy. Reason 6. Poor sleep habits and lifestyle. Most common reason. For most people, fatigue and poor sleep are not caused by disease, but by everyday habits. The CDC stated that more than 35% of adults regularly get insufficient sleep. Late-night phone use exposes the brain to blue light, which suppresses melatonin and delays sleep. Irregular bedtimes confuse the body clock. Late caffeine, heavy meals, and lack of daytime movement all reduce sleep quality. Simple changes such as keeping a regular sleep schedule, limiting screens before bed, getting morning sunlight, and staying physically active often lead to noticeable improvement within weeks. When should you seek medical advice? If fatigue lasts longer than 2 to 3 weeks, affects daily function, or is accompanied by unexplained weight loss, breathlessness, chest discomfort, or mood changes, it is time to see a doctor. Fatigue is common, but persistent fatigue is not normal. Taking early preventive action can help avoid bigger problems later. If this video is helpful, click the like button and share it with someone who might benefit. If you'd like deeper explanations on specific causes, leave a comment below.